Hey everyone, my name is Dr. Dolores Tarver. I'm a licensed psychologist here in Georgia, and it is time for the TT Time with Dr. Tarver. It's a wellness-based podcast. It is not intended to be a substitute for a relationship with a licensed mental health provider. Welcome back. Yes, it is Wellness Wednesday again. We're gonna work this thing out in June. I am gonna take a much needed break from podcasting in July, get back on track. But we're gonna finish out this month strong. It is Men's Mental Health Awareness Month and Men's Health Awareness Month, and I am talking about some issues that impact men. We got into making space for men to be able to address their mental wellness. In our first week, last week, we discussed aspects of healthy fathers. And this week, you all may remember, I did a episode on um, black women who grew up with dads who had been incarcerated. And I talked a little bit about the experiences of those women. And so for this month, as we are honoring our men, I want to talk a little bit about some of the challenges that men who have been incarcerated experience. And just kind of get into the effects of that incarceration and some of those risk factors associated with recidivism. All right, let's do it. So, of course, we recognize that black and brown people are more likely to have harsher sentences than other ethnic groups. Also do recognize that they tend to be targeted more by police. And so often when we're talking about reform in our prisons, the school to prison pipeline. We're talking a lot about issues that affect oftentimes a lot of people of color. I do recognize that there is an intersection of race and class, um, and it is one that is well documented. And oftentimes, when men talk about reentry, they're addressing some of the impact of those things. So, I am going to be focusing primarily today on some of the challenges that can be affecting all men, but I am going to highlight some of the things that are particular to men of color, primarily black men. So, I would say that there are, being incarcerated, there is multifaceted, but I'm going to hit on the economic disparities, the educational disparities, the health disparities, and the social disparities, and then also the recidivism rates today. And we're going to talk about some support resources and also just how we can be supportive of people who are trying to make changes. And I want to be really clear, right? There are a lot of reasons why people end up being incarcerated. Some of them is failure to pay child support. Some of it is honestly substance use. Some of it is mental health. Some of it is uh, young and not making good decisions when you were younger. Some of it is self-destructive behavior. Some of it is survival, and then there is a whole other element of people who aren't going to fit into this category that I'm talking about. So, what I'm primarily talking about here are going to be um, people who had minor level offenses, even if they receive harsh penalties for them. And these are the folks who have the opportunity to be able to be released from prison, who aren't serving death on death row, who aren't um, life in prison. You might have done under 5 years, 5 to 10 years, 10 to 15, 15 to 20 years, right? So this is kind of the group I'm specifically addressing today. There's a whole other set of issues when you talk about the people who are life and death row. Right, so we're talking about people who would have the potential for reentry, maybe even some of those who were wrongly accused, and wrongly convicted, and who are now the exonerated five would be an excellent example of that, who are now um, trying to reconnect in society after being incarcerated for those periods of years that I talked about. So, as we talk about economic disparities, there are a lot of things that when you have been incarcerated, particularly depending on uh, what you were charged with, then you have limitations in a lot of areas. You may not be able to serve in any kind of public service at all. So, in terms of being able to make changes in your community, to be able to address some of the issues, particularly that might have led to your incarceration, for example, may be off limits to you. You may not necessarily be able to qualify for student loans, to be able to further your education, to be able to have opportunities to a lot of people utilize their student loan money not only to pay for education but also to pay for other expenses that they have that allows them to be able to financially support themselves and potentially financially support other people while they are trying to find employment opportunities and to have some long-term growth in order to be able to have some economic impact. um, it is incredibly difficult to find jobs when you are out on parole. One, there's a lot of just negative, I think I will say stigma associated with formerly being incarcerated. And often people who have been incarcerated talk about how they're treated in terms of even looking for jobs because they have to disclose that they were incarcerated, except for in food service industry and a few other industries, right? But these are also lower paying industries. And so often people are able to get a job. They can um, be someone that, essentially is a busboy, a cook, um, being able to be in the capacity of being behind the scenes in the kitchen, if you will, but lower pay, often working long hours, probably being overworked in addition to being underpaid, and then oftentimes being belittled and threatened frequently, and feeling as if, you have to do whatever you're told to do because you need to have a job. Because one of the other things that men who have been incarcerated talk about is being able to afford child support. And oftentimes, and of course, you recognize how expensive it is to be able to support children. And so you have somebody who's in arrears because they've been incarcerated, they haven't been able to pay child support, and now they have a job. What's going to happen? All right, we're going to be looking at trying to take probably a good chunk of that money. People also talk about working for these temp agencies, and after they get their fees, really their take home pay isn't anything that they could live on, much less support a child. Then there are also the child custody restrictions that come along with when men have been incarcerated. And so, even being able to access their child after they've been released is a challenge. And frequently, one of those barriers is economic support. So even if you can come visit your child, you want to actively be involved in your child's life, you um, pick them up from school, you take them to school, you help them with homework, but you're not paying, that can definitely be a challenge. And because it takes so long to be able to get some of the rights restored, particularly for people who had a felony conviction, then it can be a long time before they're able to have other opportunities. And, patience grows thin with men because it feels like, oh, you need to get off your butt. You're being lazy. You're not taking care of things. You're not doing as much as you can. You need to figure it out and get out here and hustle, which speaks to the recidivism that we'll get into later. And so that ends up being, if you say a domino effect, economic to me would be one of the biggest barriers to people not getting back into a situation where they're doing illegal things to try to generate income, because there are a lot of reports that agencies will help you be able to get employment and transitional programs and job programs, but often they come with limited slots, and so they're not available to everyone. There's a lot of criteria that have to be made. Often people don't necessarily have transportation. When they were incarcerated and they're coming back to nothing, right? Some of them are homeless. And so then you're not necessarily in a position to be able to access these programs. There may be limited spots in these programs. There may be limited funding in these programs. As you all know, a lot of funding for a lot of things gets cut over the years. And oftentimes, yeah, I mentioned that overpromising and under delivering, there are all of these things that people think will be available to them, but they're not. And particularly for those young men who were incarcerated in their teen years and now they're coming out and they might be in their 20s, they might be in their 30s, then that's a lot of gap in their employment history, right? They might not have had a job, or they might have not have had a job in 5, 10, 15 years, right? So that also that you are risky hire, if you will, for some people, and they're not going to consider you for employment opportunities. We also recognize that youth that enter the justice system prior to age 15 have the worst outcomes for a lot of things, whether that's education, economic, and their health. And particularly if that young male is African American, his risk factors are even higher. We recognize that there is a correlation between lower educational achievement, and also just being able to attain an education, being able to finish school or get that GED or get some skills based training that are associated with incarceration. And we do recognize that oftentimes one of the risk factors for incarceration is growing up in families where there's not enough support. So the lights may be off. Might be inconsistency in our housing. We may not have enough food. I may have a sick parent who I'm trying to support. I may have younger siblings who I may be trying to support. It may be that I'm in a neighborhood, in an area where we live, where most of the people around me were engaged in criminal activities. So that is what I've been seeing as I've been growing up. And being able to walk away from that. Like some youth are not in a situation where they have any protection against that. So it's either I get into some of this illegal activity or some harm is going to befall me. And so you talk about adding those risk factors up, not to mention illiteracy. Young people can't read, then they're oftentimes going to be at higher risk for being falling out of the educational system. And then we do know that some educational systems are not set up to teach our young people, don't have enough resources, don't have books, don't have the capacity for a diverse range of learners, don't have parapros or other support professionals in place to offer tutoring to help with reading skills, to help with math skills. And so as our young people fall further and further behind, and then I'm embarrassed because I can't keep up, I'm failing out of school. And so what are going to be my opportunities when I don't have the educational capacity to move forward? And even if maybe I might be gifted in other areas because my grades aren't where they would need to be to allow me to be able to qualify for these opportunities, then I don't even get a chance to nurture that. So if that was sports, or that was debate, or that was leadership, community service, whatever it may have been, but because I'm unable to read, or I've got a math disorder or a reading disorder, or dyslexia, or I may have some cognitive challenges that may interfere with my ability to be able to process quickly. Then now I'm in a situation where I'm having issues with comprehension and understanding, and so again, the risk factors increase, right? And we know that if you don't have educational resources and you don't have economic resources, then not only are you going to be at higher risk to engage in activities that will allow you to be able to support yourself, but your forecast is not favorable either, because what is it that you're going to be aspiring to? Because again, a lot of the programs that would have assisted with job skills training, being able to help you get that GED, those programs may have been cut. They might not even be available in your neighborhood, and which is again some of the reasons why our young people end up incarcerated. We talked last week about fathers. We know the presence of a father is very important in the home, and so often men who uh, have frequent contact, particularly with the juvenile justice system, that correlation is that there is not a male present in the home, or the male that is present is engaged in similar activities, right? And so we're bringing our kids into this environment of doing the same thing we do, or it might have been your uncle, it might have been an older brother that's bringing you into this environment. So again, that's what's being modeled for you. You might be quite intelligent, quite gifted, quite bright, and they see that potential in you to be able to help them more effectively sell drugs, or laundering money, or stealing credit cards, or whatever the case may be very computer savvy, being able to engage in fraud, and reaching out to people and swindling them out of money. One of my clients was talking about a very elaborate scheme that even happened at her job, where she received a phone call. Somebody was in the store, and then there was another person who was connected to this, that was pressuring her that she needed to get money to give to them, to get her employment place out of a situation, and that she had to take money out of the safe and go deposit in an ATM. Like, she was terrified. Um, so there are people who can see the potential in our young folks, and groom them in such ways that they're taking their abilities and using them to enter into criminal activity. And so oftentimes our young people are being led astray by people because they don't have the support resources in place, or maybe they do have parents in the home, but there is the allure of what can be offered to them by these other folks, that social belonging, that connection, that being able to have. I think all of us wants to have an identity where we're affirmed and we're valued, and we're considered, and this speaks to the masculinity part. We're considered to be, that dude, masculine, top dog, alpha, whatever it may be, that lets people know that you have something to offer. And so oftentimes we're seeing young people get into these spaces because they want that. They want to have that level of respect from people in their communities. We also recognize that health disparities are significantly increased when a person is incarcerated. They're at more risk for physical and mental health conditions. Usually they have worse health by the time they hit retirement age. Incarceration is often associated with substance abuse, whether it starts there or is exacerbated there. We do know that there is an increased potential for violence in certain correctional facilities, and there is often, this what happens when you practice, right? I've talked a lot about whenever whatever you practice becomes your process. When you grow up in a system that keeps you in the system, essentially, right? The goal is to keep you there because the benefit is for you to be incarcerated. And so oftentimes you're set up to not get the resources you would need to be able to be successful after you're released. Every correctional facility is not a healthy place. Some of them are poor conditions, poor the food choices, being able to get out and get exercise, how people who are incarcerated are treated, and also just them trying to find safe spaces. And again, that whole identity and protecting themselves and being able to be mentally healthy when you're not necessarily getting fed anything to help nurture and support you and connect you. And so, of course, then what's going to happen? You have reentry stress, you get out, you're ill prepared, and then you didn't have the best medical care. Like you get some basic stuff in there, like maybe some pain medication, but often dental care is you get that tooth pulled or you don't. Often, um, the care is, unless you are, gravely ill, like get some rest. And so in the mental health counseling as well. And so oftentimes the things that led to the incarceration, again, they're being exacerbated while I'm in there. And now I got to pick up these survival skills, these habits that are going to allow me to be able to get through this, which means that I am going to numb, or I'm going to align and pick up some other habits, right, for my safety, or I'm going to be victimized. Right? So none of those are going to be associated with positive health outcomes. And then there's the social disparities, and a lot of men who have been incarcerated talk about, again, that masculine identity. What does it mean to be a man, and what does it mean to be a man once I've been incarcerated? Because then I'm rejected from certain circles. There are some circles that will accept me, but they are often associated with risky behaviors. They're often associated with the things that are going to get me right back incarcerated, right? But then to other people, I'm treated as less than a man. You're not taking care of your children. You've been over here. Your mama had to pull weight. Who I might have been dating before I was incarcerated. Now that person might be dating someone else, and my children have now connected to this person and not me. So I feel like I'm being rejected and I'm on the outskirts um, of a relationship with my children. Family members often will have a lot of negative things to say. And that is if you even still have those family relationships intact, because sometimes, again, people will cut you off after you've been incarcerated and that support isn't there. And then people often, they may accept you under conditions. Like you can come and live here if you do this. You can come and live here if you give me this. And so, again, making it very difficult to establish trust and healthy relationships with people, and also be able to have that sense of self and that worth and that pride, particularly as all of those other areas we talked about may be out of balance. So, of course, we recognize that all of the things we talked about are associated with higher recidivism rates. Um, Black males often have the highest recidivism rates. Again, it's the process of paying restitution, whether you have a probation officer or whether you have um, child support or other fees that might be associated with whatever led to you being incarcerated. Often that being met with the stress from people like, you can't just keep living with me. You're not bringing any, you can't even help me. You're not bringing enough money in. You're not helping to provide this support for your child. And so, you talk about returning to a community where there's lack of jobs, poor health care, inadequate education, lack of affordable housing, then what are you going to do, right? Your risk factors are higher, especially if you don't have any usable skills. And most people, again, are just trying to figure out how they can take care of themselves, maybe how to take care of children, aging parents, get some of the health things that they need, but also the patterns that have been learned, right? And we recognize that, again, whatever was practiced, whether that was survival mode or whether that was self-destructive behaviors, numbing myself, trying to mute the pain, trying to connect, trying to prove my worth, all of these things that are going to typically lead a person back to being incarcerated. So, what can we do to be supportive? There are some reentry programs. Um, and there are some correctional facilities, and there are some transitional living facilities, as well as community based organizations that do support individuals who have um, been released and who are trying to re enter and do it successfully. And it's just a matter of identifying who those resources are. Here in Columbus, we have a second chance outreach program. It's in Columbus, it's in Atlanta, and it was started by a woman who faced a lot of these things that we talked about today. So there are organizations, there are mentorship programs, there are training programs. Often they do require a high school diploma or a GED. They will help you get that, but they want you to be, you already have to kind of be ready to go and focused. And again, some of them have waiting lists, but those potentials are out there. And I think finding that mentorship, finding that person who's going to help guide you, maybe someone who has successfully been able to re-enter their communities and figure some of these things out, to be able to help offer that support. There are also, here's your plug for counseling. There are also agencies. Here we have Valley Healthcare who have health and mental health services for men and women. And so you're eligible to get that without insurance, without the finances. They even offer transportation for you. So finding what those look like in your organization, finding organizations that offer, we have the family services here in Columbus, that offer family support to be able to talk about reintegration back with your family units, to reconnect with your children, to be able to navigate co-parenting relationships, to be able to learn some of those family skills, because maybe you didn't get a chance to learn those things. You might not have had that in your environment, and it hasn't necessarily been nurtured during your period of incarceration. There are absolutely addiction programs, substance abuse programs that can help for individuals that are struggling with addiction issues. And there are some housing programs. Those are fewer and further between and oftentimes have wait lists. But there are some places that might be able to assist in the meantime, even if it may be some of the men and women shelters, or men's shelters, until a person is able to qualify for some other programs. A lot of programs require you to be employed. And so, some of them is successive in taking that time and being able to work through that. There are some good reentry programs that help empower men as they transition back into the community, and also just being able to offer some of that workforce assistance and guidance. We know that Goodwill offers some of those. We recognize that there are some of the programs may be unique to your area, and so just make sure you're doing that search for your area to see what kinds of programs might be available to you. And again, making sure it's still being funded, or if the name may have changed. So those are some opportunities. But you may know someone, you may have a loved one, you may have a friend. It may be you who has had an experience with incarceration and were able to find some resources. And so definitely encourage you, that men's group at church is a good option for you to start to be able to figure out where those resources are. There are safe spaces for you, and mistakes don't mean that you can't move forward in healthy, positive ways, but we want to set you up for success in the best ways that we can. All right. Be well.